Severe tricuspid regurgitation is a very frequent valvular heart disease which is associated with poor outcomes if left untreated. Many of these patients are not good surgical candidates, and therefore other therapies need to be evaluated. Transcatheter therapies, and particularly the edge-to-edge repair, which improves the coaptation of the tricuspid leaflets, has been proven to be safe and efficacious in reducing tricuspid regurgitation. And this year at ACC, the results of the one-year follow-up of the CLASP-TR trial were presented. 49 patients completed this one-year follow-up, and the results showed that all-cause mortality was only 11%, heart failure hospitalizations was 16%, and in terms of reduction of tricuspid regurgitation, 75% of the patients showed a reduction of at least 2 grades, and 86% of the patients remained with a severity of tricuspid regurgitation of moderate or less. These improvements in tricuspid regurgitation were associated as well with improvements in quality of life, 6-minute walking test, and patient-reported outcomes, which is very important. And the guidelines of the last year included a recommendation for the use of this edge-to-edge transcatheter repair of the tricuspid valve, which may be considered in patients who are not suitable candidates for surgery. These results reinforce that recommendation and helps to understand the place of these therapies.